Shockwave for plantar fasciitis, a case study review. So the long-term results of extracorporeal radial shockwave therapy for plantar fasciitis produced a study where after 5 to 6 year follow-up, they went and looked at how did people do. So it wasn't just, can we get you out of pain today, but how long are those results going to go for? And then they asked people to grade, how did they do? So they basically divided people up, put one in a traditional physical therapy pathway and a second receiving shockwave therapy treatments, and then came back to see how did they do down the road. Now, what was surprising was the shockwave group really did well. 69% reported excellent results, 13 good, 6 fair, and 11 poor. What were they doing? They were using mechanical impact to hit the bottom of the tissue, hit that fascia to break up the scar tissue and trigger the healing response. Basically, we're trying to irritate the tissue to make it come back and heal stronger again. This is super effective in areas that get those bad patches or adhesions or scar tissue, whichever term you want to use. And the bottom of the foot is notorious for getting scar tissue. Now, the reoccurrence rate was only 11% in the shockwave group versus 55% in the control group, meaning that after the initial treatment, 11% of the shockwave people came back and had plantar fasciitis flare up again, where the traditional physical therapy, exercise, stretch, icing had a 55%. So huge difference. And when you look at the results, we saw the difference in the excellent between the traditional and the shockwave at that 5 to 6 year mark. 55% said good in the traditional and 13 in the shockwave, where shockwave reported that 69% excellent, where traditional only called 0% excellent. So people were much happier overall in the shockwave. 36% of the traditional said fair, while only 6% of the shockwave group, mainly because many people were doing good and had minimal kind of problem. I would probably expect the fair to say, I got a little bit if I walk too long, stand for too long, a little bit of a flare up, but not bad. The poor group, the 9% and 11, is really who's continuing to have pain problem with it. Shockwave, that impact is trying to break down that scar tissue and cause therapeutic trauma in the sense that we can get that healing repair to go back and do what it should again. The traditional therapy group of NSAIDs, orthotics, physical therapy, exercise, cortisone injection, they had a decrease in pain right away, but really didn't have near as good as results 5 to 6 years down the line. And that plantar fascia, as we see, is the bottom of the foot. So every step you take, those impact forces are being absorbed by that tissue. And if you have that spot, that weakened zone that just didn't heal right through therapy, there's a good chance it's going to flare up again once you increase stress loads upon the tissue. And that's really why plantar fasciitis is so hard to treat. It's usually a chronic repetitive stress injury, as in how many steps do you take a day? It's just not with jumping and basketball or running, but standing on hard concrete floors and poor shoes. That impact force is coming somewhere. And whether it's the bottom of your foot that absorbs it, the calf, the knee, or the back, those forces are being absorbed by the body. And as we mentioned before, that plantar fascia in the bottom is notorious for not getting great healing and repair, partly because if you damage it on Monday and then go out again on Tuesday, Wednesday, Thursday back to work and we're overwhelming it, it doesn't have a chance to heal. So it's trying really hard to repair the tissue, and sometimes it can't. And it just throws down that cheap patch, that scar tissue. And the next time you go back to work, you're overwhelming that cheap patch, and it's just throwing down more and more of that patch to get through the day. Sometimes the body can come back and pull up the patch and repair and heal, and sometimes it doesn't. But that patch is the weak spot. So if you really start increasing your activity or a force upon the foot, it's the one most likely to flare up. And there's just no way to not put force on your foot. Are we going to tell you not to stand or not to walk? You got to move. One of the things we always want to improve on is calf flexibility. If the calf remains tight, you're changing the lower leg mechanics, increasing strain many times that bottom of the foot. So one of the keys to plantar fasciitis is improving the integrity of the calf muscle, getting better flexibility into it, and then getting strength in that lower leg and especially those foot muscles, making sure they're doing everything they can to maintain the arch, absorb the forces, and then spring load forward in our normal step and walking gait. And then we also need to make sure our low back and pelvis strength is good, because if our glutes and our back and all the pelvis muscles fatigue, it's going to change how you walk and how you move, And many times that shortened gait is more stomping, so more impact on the bottom of the foot. And it's always tough to get patients to really work on that balance, that proprioception. The better the foot mechanics work, the better our balance is, the better the joints move in space, the less of the negative and bad forces the foot is going to have to absorb. And that scar tissue just builds up over years. How many steps have you taken? How many times have you walked, ran, or stood in shoes that just aren't great? Or in Arizona, you come down and you start wearing flip-flops year-round on the tile floors. That impact force increases, overwhelms the tissue. So really, at the end of the day, our successful treatments involving decreasing pain. Obviously, we got to stop hurting. And then we have to slow that daily tissue damage to eventually stop it while upregulating the tissue repair. How can we make the body break down the bad scar tissue and adhesions and build it back with better, stronger tissue that should be down there? And that's where the Shockwave had its biggest benefit. I'm sure in the regular PT exercise steroid group, steroids and NSAIDs were knocking down the pain and inflammation, but it also does slow a little bit of that healing and repair. So we probably weren't getting as good of tissue repair as we could have. The exercising and stretching alone helped calm down the system and probably improve some of the mechanics because we saw results from it, but it didn't break down that bad scar tissue and make the body put down good tissue in its place. It left that cheap patch that then flared up again later, which is why so many people had a high reoccurrence rate or only graded their progress at fair or good. And successful treatment also improves that lower extremity mechanics, those foot muscles as we talked about, maintaining the arch and the lower leg, and getting that pelvis and legs to work together to stand, walk, and move. And really, when we think about it, you have to have the lower extremity handle all the stress loads you're going to place upon it, not just today, but in the future. So the system has to get strong enough to handle the forces. And those are things we have to get to in therapy, make sure the tissue heals, and get it strong enough to handle today and tomorrow without the flare-ups. And that's why, from a treatment perspective, we really see that no one treatment is the cure-all. Most people are going to require a combination of treatments. I don't think any one thing is going to work for most people or work well. We even saw the Shockwave group did pretty good, but there was a fair amount of flare-up still with that. And I wonder that if we had combined these and done the traditional therapy that the control group did with Shockwave, what would those results have been? I really think that would have been better. And we always have to talk doing good and bad. You have to find ways to do more good for the body than bad. If you keep standing and jumping and pounding and overwhelming that foot, you're doing more bad. The system's going to flare up again. But if you can do more good with the exercise, stretching, icing, Shockwave, tissue healing, you're going to tip that scale in the good and get the tissue to heal and repair. And that's that challenge versus overwhelm. So in this image, that blue line, if you go to the right of it, you're causing micro rupture, overwhelming the fascia, breaking it down. If you go excessively far, that's when we lead to failure and rupture and big tearing of the tissue. Many times in healing, we want to stay to the left of that line. We want to come up and bump and hedge to trigger the healing responses to happen. If we do nothing, say at that far left-hand side, the tissue is just not going to heal. It's not going to be able to handle what we need to in the future. And what does that come down to is combining different treatments, finding ways to decrease the pain and inflammation with the lasers, exercise, stretching, icing, NSAIDs, cortisone as needed, and Shockwave and Graston to go after those soft tissue spots that did not heal well and are likely to flare up again. If we can break down that tissue, we can trigger the healing to repair to what we need. So you're more than welcome to download our plantar fasciitis treatment guidebook at the bottom of the listed page, or from our website, going to the conditions and plantar fasciitis. Down at the bottom is an opt-in to get the book, or you can get a paperback online at Amazon. So it goes through treatment options, a bunch of different things you can do at home, and then exercises in the back to work for that lower extremity mechanics. I hope this information has been helpful and look forward to producing more content that helps make you better.